Eugene Robinson and Michelle Bernard of the Independent Women's Voice. Both are MSNBC political analysts. Michelle, you first. Are the Republicans smart to have people like Jim DeMint out there saying, let's kill this thing in its bed? Let's kill health care because it's a way to kill Obama.
Yeah, no, it's not smart at all. It's not smart politics. It would appear that that's the only thing that some Republicans feel that they can talk about. But there are a lot of problems with the bill itself. And really, if Republicans were smart, they'd be talking about patient-centered health care, what the real problems are with the bill, and what Republicans stand for in terms of health care reform, rather than killing Barack Obama.
Gene?
I agree with Michelle. It's not smart at all. I think the question now is, how does the president take control of this issue? How does he get out in front of it? And how does he tell Congress, rather than let Congress work it out themselves? I saw him on Friday. He says, well, we got 70% of the way through my method, so it's not that shabby. Yeah, I was
Is he willing to detail what he wants?
I didn't get the sense. He didn't detail everything that he wants to me, but one certainly gets the sense from what we've seen Friday, again today, and what we're going to see again during the week, he's willing to step out on front. And I think that necessarily entails saying, okay, look, here are some definite lines. Here's what we definitely need to have. We need to go this way, not that way. And he needs to take the political heat for some of this, because the Democrats on Congress are getting nervous about having to take all the heat themselves.
This is down to 7 people.
Yeah.
4 Republicans, Grassley and Hatch and a couple other people. It's an Olympia Snow.
And he's got to rein in the troops. You saw in today's Washington Post, they've quoted David Axelrod as saying he's taken the baton. You know, if you think about that like that track and field, he is.
And you said that's wrong.
No, I think it's right, but he's risking a lot. You know, if you think about it, we're almost looking forward to the midterm elections, and if he loses health care, it's almost as if he is risking whatever the legacy of his presidency is going to be. If he loses health care and he's the person who's the 4th leg of that relay race, and he loses, what happens during the midterm elections?
Let's turn the pillow over to the cold side. Nobody talks about this. Suppose the Republicans get blamed for killing health care. Isn't there a downside to that?
Yes, there is a downside, because every poll shows that people want health care reform and people want Americans to have health insurance, and this is a tremendous problem for a lot of families. So yes, it's a problem for Republicans. I think one thing we should keep in mind through the next several months is that if it does pass at some point, nobody's going to remember whether it passes in August or in October or November.
But you got one window. It's called the first year.
Exactly. Now, if it doesn't get through the first year, it may not get through.
Do you think they could pass it in the fall, if not now?
Well,
you think if they slip on this is a key question. If they don't get it done, get it to a conference committee between the House and the Senate by August, will they have a chance to get it done by Christmas?
Yeah, I think they'll have a chance, but it makes it harder.
Michelle?
They have a chance, but I mean, I disagree with Gene on one point. If the Republicans...
Did you call him Dream, Gene?
No. No, my buddy Gene.
I'm going to check the tape.
If the Republicans, basically kill a bad bill, I don't think that they're losing anything. I don't think that anyone's getting to the heart of the real argument yet. We keep saying if they pass it, what is it? Are we talking about patients' rights? What is it?
Okay, do we need to have something that you can go to like a credit union, where if you don't get a good deal from a private insurance company, you can get some other option that's maybe cheaper and a better deal? Does the government have to offer something and put something out there as an option?
My opinion, yes. My opinion, it's said to keep the insurance companies honest, but to provide that sort of option for pre-existing conditions.
Gene Robinson, thank you. Pulitzer Prize-winning Gene Robinson and Michelle Bernard, both analysts here. Thanks for joining us. This is getting close. This healthcare thing could die. It could win in the next couple weeks. When we return, how a suspected terror leader can live freely in Europe.